Musculoskeletal ultrasound is a tool we use both diagnostically and interventionally. Ultrasound is basically transmitting sound waves through a transducer into the body.
Those submit back to us basically different textured materials. So whiter materials are going to be more dense objects, darker materials are going to be less dense objects. And it helps us a lot both with diagnosing and sometimes treating musculoskeletal issues. PNT stands for percutaneous needle tenotomy, and it's a procedure in which generally with tendons, specifically tendons that have either an overuse injury or tendinopathy, wear and tear, chronically over time are treated with a needle, and oftentimes we use ultrasound to guide our needles. In my practice, I do use the ultrasound for diagnostics, but I also use it for injections, and the majority of actually my use of the ultrasound is for injections. And the reason I think that that's so important is you actually can see where you're putting the medicine. And so a lot of the times if you go to someone who's not trained in this type of modality, you could have an injection, but it might not actually be in the place you're wanting it to be. It might not be treating what you're aiming to treat. You might accidentally put it in a muscle that's completely unrelated to where a tendinopathy is. And so for me, it's incredibly important to know exactly where I'm putting the medication, so we're actually treating what's the issue.
Really, there is no preparation necessary. We just need to be able to access the area that we're looking at. So if we need to change a patient into shorts or a tank top to evaluate, but there's no special preparation. We may recommend remove any jewelry or watches, things that may be in the way, but beyond that, there's no preparation required. As I had mentioned before, there's no radiation, so it's safe to use on pregnant patients or patients with defibrillators and other devices that wouldn't necessarily be a candidate for an MRI.